We previously looked at the various components of a legally written prescription. Now, for the next few minutes, what we're going to be doing is to look at how to generate that prescription label, having received a prescription. What will be covered? You want to be able to identify the various components of a prescription label, and after that, you should be able to design the label for a prescription medication. Now, let's look at the various components of a prescription label, and we'll do so, of course, using a prescription. So our prescription here is tab cephalexin 500 milligrams, and the instructions for the patient is 1 by mouth every 12 hours after meals. Instruction for the pharmacist is to give 14 tablets. Now, when you look at the parts of the label, I have generated that label, which is in the center here of your screen. What exactly are supposed to be present on that label? So the first thing that you should have is the name of the pharmacy, the address and contact information for the pharmacy that filled the prescription. The second bit of information that you want to include on the label is the name of the patient. So this patient here is Janet Jones. A prescription number. Now this is very important, and similarly to the prescription where you might have a medical record number, the prescription number here is the unique locator for this specific item, and it's unique to this patient's prescription. The other component, the name and strength of the medication and the dosage form of the medication that the patient is getting. So in this case, we're dispensing cephalexin. It is a tablet. The strength of the tablet is 500 milligrams. Okay, and in terms of the instructions now for use, this information is represented clearly here in simple language. 1 tablet to be taken every 12 hours after meals for 7 days. Other component of the label, the prescriber information or the name of the prescriber. So in this case, we said Dr. Singh was the one who wrote this prescription. Other bit of information, how much of the medication did you give? So we gave 14 tablets as per the request from the prescription. Sometimes it's also important to include the refill information as well on the label. It helps to warn the patient, especially if it is a medication that has repeats. Sometimes in the case of, say, chronic medications, patient is going to be taking that for some extended period. Putting that repeat number there also helps to alert the patient when they are no longer, or when they no longer have repeats remaining at the pharmacy, so they can go back and get a new prescription from their doctor. And most essential here, of course, is when was this prescription filled? Another bit of information, the expiration date, and this is the expiration date of the specific drug that is being dispensed to the patient. And especially for those compounded prescriptions, this becomes critical. It should be included on the label. So having learned the various components of a prescription label, let us see now if you are able to generate a label for these prescriptions. So in terms of some general considerations, this is what we're looking for in terms of a label to ensure that you have simple language and that the patient is not confused having read that instruction. So we'll start with either an active verb or a passive phrase. Now, active verb, would be something such as take, inject. Okay, so those are some examples. Passive phrase, to be taken, and that would be preceded by what are they taking. Secondly, how much of the drug? So you take 1 tablet, or take 10 mils, or inject 30 units. How are they supposed to take the medication, or how are they supposed to use the medication? And this we refer to as the route of administration. So the medication is to be taken by mouth or is to be injected subcutaneously. How often? And this is the frequency of administration. 2 times daily, at bedtime, every 12 hours, 3 times a day, every 4 hours. Those are some frequencies. And then these are some additional information that may be included on the label as well. If it is included in the signature, and depending on the medication, you might want to replicate this in the label instructions as well. So how long, or the duration of therapy? So for some antibiotics, it may be essential for you to write the number of days. So in that case, you may be saying take it for 7 days or take for 10 days. Sometimes you will also have some special considerations for certain medications, and the doctor may have additional instruction as well. So you might see things such as when necessary, or take it after meals, take it half an hour before food, take until finish, and there are a list of others that may also be included. Those can be included on the label to increase or improve the patient understanding of how to safely use the medication. So now that you have completed how to identify the various components of the label and how to structure a label, let's see how you would write a label for this medication. So you can pause here, write down your response, and then we can compare and see how we did in terms of our response. Alright, so that's one. You have another one here. Again, write down your instructions, and once you've written down your instructions, then we can compare. Alright, so I did pre-prepare something here. Now for the first prescription, amoxicillin suspension, 50 milligrams per mil, the signature or instruction for the patient is 500 milligrams BID, MITE 10 days. That's instruction for the pharmacist, MITE 10 days. What would I replicate on this label? Take 10 mils by mouth every 12 hours for 10 days. So that is instructions for the patient. Now for the insulin prescription, where it says injection, Novolin insulin 70/30, 100 units per mil, the patient instruction, 30 units subcutaneously 2 times daily before food. Pharmacist instruction, give 20 mils. What would I tell the patient? Inject 30 units subcutaneously 2 times daily, half an hour before food. I hope that what you wrote down was similar to what was here. Now that you have reviewed the parts of the prescription and the various components of a label as well as design a label, you can go to this website that is displayed here for additional information on how to interpret the prescription.